Hi, ladies and gentlemen. Thank you so much for joining us and for being here for the Mental Health Matters panel discussion. My name is Fatima El Mahmoud. I'm a social media journalist with the National News. A lot of my coverage for the National has focused on mental health. And I'm also a Rosalind Carter Mental Health Journalism Fellow as of this year. I'm very excited to be here, and I'm very excited to be taking part of this discussion on a very, very crucial topic with some very distinguished speakers joining me today. I'm going to introduce them, and then we will jump right into it. First off, we have Dr. Vedrana Mladinal, who is a course director, licensed clinical psychologist, and associate director of counseling at the New York University of Abu Dhabi Health Center. We have Her Excellency Hind Mubarak Al Zabi, Executive Director of Healthcare Facilities Sector at the Department of Health of Abu Dhabi. We have Dr. Umniyat Al Hajiri, who is an Executive Director of the Community Health Sector at the Abu Dhabi Public Health Center. And we also have Dr. Samir Makhoul, who is a consultant psychiatrist at Al Reem Hospital in Abu Dhabi. And joining us virtually, we also have Dr. Khalid Saeed, World Health Organization Regional Advisor for Mental Health at the Regional Office for the Eastern Mediterranean. Thank you all so much for being here. I'm going to jump right into our first question. Our first question is for Dr. Vedrana. Can you please let us know what is New York University's global vision for mental health?
Yes, good afternoon, everybody. It's lovely to be here, and it's especially an honor to be among such esteemed co-panelists. NYU Abu Dhabi, as you know, is a part of the global NYU New York University network. We have students all over the world. Of course, we care about their mental health. NYU takes pride globally in providing a very comprehensive mental health care for our students. And whatever there is in New York and on our campus, main campus there, we actually mimic and have replicas of that all around the world, including Abu Dhabi. We have our own health center for students that is actually primary care center where we have mental health services embedded in the center. So we are actually walking the walk of integrating mental health services into primary care. And we know that it works for our students, for young people.
Thank you so much, Dr. Vedrana. So it's clear that NYU's vision for mental health, it's very clear, it's very aspiring, which brings us to our next question for Ms. Hind. Can you let us know what are some of the key mental health challenges in our sphere today and how the Department of Health in Abu Dhabi works on addressing those?
Thank you, Fatima. Good afternoon, everyone. Happy to be here. Happy to see the crowd who are really interested to hear about the initiative that the Department of Health is leading. To answer your questions about the challenge, the Department of Health has developed the comprehensive, overarching strategy that integrates every single facilities within Abu Dhabi that interacting within the mental health journey. So the overarching strategic model, it caters the need of fragmented system. So when you integrate every single facility within the society to create that comprehensive integrated model to cater the mental health patients. So what we have started by developing that strategy, tackling from the first age, from the first days, including the early childhood authority, all the way to Abu Dhabi Department of Knowledge and Education. So we are taking it from the beginning where we are increasing the awareness, the screening. I think Dr. Amniyat will tackle on that, all the way to the facility that provide the services at early at the beginning. Let's say from the primary care setup all the way to specialized care, all the way to the back to community when we integrate them back to community with support and help of the Department of Community as well. So all the pillars within the community are working together comprehensively to deliver that message that we are here to support you. Before, it was very difficult. It was taboo to talk about, the mental health issue. Now we are emphasized from the school that you need to talk about your issue, you need to talk about your mental issue that you're going through. So we are increasing the awareness, the screening factors, enabling every facility within Abu Dhabi, especially the primary care
to serve the moderate and the middle case, let's say, all the way to specialized care. One of the items that we worked on is developing the capacity master plan, where we've identified that most of the cases are under screened. So once we've started the screening, so the number of the cases which will be diagnosed at the primary care would require the specialized care. So that's why the whole program is built in a way, starting from the school all the way back to community, integrated with the support of the Department of Community.
Thank you so much. That's very interesting. So you mentioned a few keywords, which are screening, which are awareness, and that brings me to my next question for Dr. Umniyat. Can you let me know the role that the Abu Dhabi Public Health Center is playing in raising mental health awareness in Abu Dhabi, and how you tackle challenges that we've already discussed as well?
Thank you for the question, and thank you for the audience to be here. I think what we do best in the Abu Dhabi Public Health Center is to ensure that we are team players and that we bring everybody together. I think we've learned from the long-term challenges that we've seen in mental wellness and mental health that there will never be a success unless we all work, each of us focusing on their areas of interest. So for us, education and awareness is a bread and butter. The whole institution has been actually established to look after improving health in general, and there is no health without mental health, as simple as that. We start from the grassroots, we start from schools, we are even planning to introduce basics at a nursery level, because we do believe that it's actually the full human structure that help him to build the resilience and to support himself and his community in being stronger. So what we do is not to go and just talk about mental wellness theoretically, but what we are trying to do is to give people tools and possibilities of building their self-image, building their resilience, educating the educators and the trainers on their role in building the character before building the body from a health perspective, and building the character before building the grades when you are in school. We also look for the other age groups, and what we try and do is to be in the outreach as much as possible to every group, especially groups that have special needs, groups that are vulnerable by nature, or during the time of the pandemic. So we were proud of working with the national level on establishing the HOPE helpline, working on a local level on establishing the mental wellness helpline through Istijaba. We wanted people to have a way of communicating. Sometimes all what you need is somebody that's an expert to listen to you and to refer you appropriately. So within the spectrum, we try and align. We put our strategies based on the Department of Health strategy, integrated with the government of Abu Dhabi strategy, but then also aligned with all the national strategies that come to talk about mental health, mental wellness, health of special groups like the youth and the adolescents, and the mother and child. We see our role as advocates and enablers. And I think there is a big element that we need to invest our time and effort on within a school setting to start as early as possible, but also with just telling people that it's okay not to be okay. And I think this is the biggest taboo we are trying to deal with here. We are benefiting from our previous experience when we started the fight against cancer, for example. It was an absolute taboo in 2004. Ladies wouldn't even refer to it by name. And now we get school competitions, we get carnivals, we get people coming out, and there are hundreds, thousands, and sometimes even hundreds of thousands. And we want the same to happen for mental wellness. It's just a disease like anything else, and we can protect ourselves if we detect early, if we build mental wellness and mental resilience, and if we seek help early. I think the worst thing we do is seeking help on time, and there is a big element of confidentiality here that we definitely need to work on to enable people to approach without worries. This is the biggest buzzword I hear, especially when I have children at their teenagers, and when I talk to them and to their friends, the buzzword is, we want a safe pathway. We don't want to go talk to a person that will just pick the phone and talk to my parents. And I think that's a bigger theme.
In that context, about the screening, it's really interesting when we had this conversation, myself and Dr. Amniyat, especially with the new program of IFHAS, that there is a part of mental screening, and we've started very small. And the interesting part, people were asking to elevate that, to enhance the screening methodology of the mental health within IFHAS program. So although it was very small piece of information that we were asking during IFHAS, but we've realized that people accepted that and they want more within IFHAS program.
The good news also is we are trying to introduce it into the comprehensive school screening. But again, we really need to be very tactful doing that, because once you let one individual down, they will never come back to you and all their friends. And I think that's why we are just taking a deep breath before we stream in.
Thank you, ladies. That was very, very motivational and inspirational. So, Dr. Amniyat, you said something very important, which is there is no health without mental health. And I think this is a lesson that we had to learn the hard way in recent years, which brings me to my next question for Dr. Khalid. Dr. Khalid, what would you say are also big lessons or important lessons that we have learned throughout the past few years on mental health?
Can you hear me now? Can you hear me now?
Yes, we can hear you.
All right. First of all, thank you very much, and thank you very much for all the speakers and the panelists for their rich interventions. I think what we need to remember is that in the last 3 years, let's say, since the COVID pandemic, mental health has been getting more traction, and it is higher up on the political agenda as well. And it's no longer just that health sector is talking about it. It's developmental sectors as well as humanitarian actors who are taking more and more interest in mental health and are putting it as part of their integral agenda, which is a great development which has taken place. And this is particularly relevant to this region, where we have countries from, say, Yemen, Afghanistan, Syria, Iraq, Libya, and so on, Somalia, who are facing chronic humanitarian crisis. And other countries are also obviously not immune to it. Man-made crisis and humanitarian and natural disasters keep on happening in a number of countries in this region. And conversely, that has helped actually mental health become part of the conversation. And COVID has provided that extra dimension and extra fillip to it. So that is one lesson which we need to learn, that mental health is important not only for health, but it's also important for development, as well as when it comes to security of a country and the nation. And the reason for that is that if you look at the figures, for example, during emergencies, as much as more than 20%, around 22% of the people would have a mental health problem. And that would mean that they are not contributing to the nation development as well as the economic development. And that has huge economic costs and developmental costs for the country. Similarly, about 75% of the mental health problems start before 24 years of age, and around 50% before 19 years of age. So that means that those are the most productive years in terms of people when they are learning skills and when they have started their careers. So if we do not provide them protection, promote their mental health, put strategies in place for prevention of mental health problems, and despite all the promotion and prevention strategies, we know that certain percentage of people would go on to develop mental health problems. So we need to put services in place for them. And that was music to my ears when people were talking about integration of mental health across the system. And not only health system, but also social care systems. We need to integrate mental health across that. So that's the other lesson we need to learn, that mental health has to be part and parcel of every activity. It should not be just the responsibility of health sector. It's the responsibility of all the sectors, whether they are education, social welfare, etc. They should be part and parcel. And one of the important things here to remember is that people with mental health problems are much more likely to have other conditions, including non-communicable diseases, which are particularly important in the context of UAE as well as other Gulf countries, where NCDs are the major drivers of morbidity and mortality. And we know that people with mental health problems tend to die 10 to 20 years earlier, mostly because of NCDs. And they are more likely to smoke, they are less likely to exercise, more likely to indulge in unhealthy dietary habits. So that's why it's important that mental health should be part and parcel of all sectors within health and other social services. That's the second lesson we need to learn. And thirdly, I think the issue is literacy. Stigma and discrimination are a major impediment when it comes to mental health. Although people are talking more about mental health in general, but still there is a wide pervasive stigma, not only in the community, but also among health professionals related to mental health. So we need to promote mental health literacy and put into place evidence-based interventions. For example, empowering people with mental health problems and their families to be part of the conversation on mental health. They should be involved in development of policies, laws, and services. So I think those are the three key lessons which we need to keep in mind. And the last one is the information and research gap. Despite all the developments which have taken place, if you look at the globally, the research output on mental health has actually gone down from about 5% of the total research output on health to about 4.5%. It's not that mental health research has not gone up. The other areas of work in health have started producing more research. So we need to focus on that, because without having clear evidence, it's difficult to develop services and argue for mental health. And last but not the least is the issue of information, that countries often do not have good information systems when it comes to mental health. And suicide is a classic example. Substance use is another example where countries do not have good quality data so that policies and services could be developed to counter these issues. So I think those are the few sort of salient points which I would like to highlight. Over to you.
Thank you, Dr. Khaled. So I think here the next question basically asks itself to Dr. Samer. My question to you is, we've been talking about the importance of mental health and the traction that it has gained over the past few years, but is the workforce in the health sector equipped? Is it ready to deal with the surge in demand for mental health services?
Thank you for inviting me here, because I think this is the main questions that we want to ask. Are we ready? And of course, hearing all the plans is something we love to hear, but do we have enough people to do what we need to do? And the answer is, globally we don't, and this nation and this region anyway is behind. So our projects are still baby. We have fantastic plans, but if we're gonna talk about how many psychiatrists do we need, if we're gonna go with the minimums that globally we want, I think we are far behind in here. So if we can go look at the population in UAE, we need 1,000 psychiatrists, we need a very fantastic integrated mental health, and we need to go with public health, because mental health is a public health issue. So here we have very minimum number of psychiatrists trying to do all the job, and that's not enough. I mean, to be honest, if we go with all our plans and we have everybody who needs to come to see us, we cannot serve that demand today, So we are not able to do that, but because of stigma, we have many people behind. And if we're gonna go what should be a nation like UAE to have the best healthcare that what we have in other specialty, actually we need more than 1,000 psychiatrists, because we don't want to go with the minimum. Actually, our people deserve the maximum, we have. So we would need in numbers, 20 per 10,000. So we need 2,000 psychiatrists. We need every GP and family care physician to be able to identify mental health and treat it as a first line. We need our schools, our public health. We need to reduce stigma. So we are behind, but we have a fantastic plans, and I can talk mainly about Abu Dhabi with the Department of Health Task Force to work on mental health. So the plan is there, the will is there. I think we need just to work really day and night, like we did, let's say, with COVID, when we put the plan and we said, okay, we need to achieve that. We managed to do that in a short period of time. So the sky is the limit, the will is there. So what we need to do, we need just to implement all what we want to do, so then to be able to do that. But yes, we are behind. The world is behind. But, I don't think, we cannot achieve that, because I think we can, because on the logistic part, let's say, do we have the medications that, we want to deliver to our patients to provide the best health care, and treatment? Actually, we are far behind, we are far ahead of, let's say, Europe, so we have the latest treatments, for Alzheimer, for depression, for all of that. That's most of the world they are not able to get. So we have that. So we have the resources. All what we need to do is we need to train people. We need to get more people to be aware about mental health and to work. And the beauty is to see Department of Health, to see university, to see public health, and to see the the psychiatrists themselves sitting together debating that here today. I think the future is very bright.
Yes, that's
Well,
right.
we are
Dr.
not debating,
Sami.
maybe. We are not debating. We are agreeing, we are supporting each other. And I think partial of this plan has been, work in progress, and partially has been implemented. In terms of the workforce, we've been working together along with New York University to upscale people at the primary care, the workforce, the nurse, the caregiver, at that setup, that venue where it's much convenient for patients to be early detected or early diagnosed at these setups. So the work is in progress, along with these people from different entities. Collaboratively, we are putting the full force together to achieve our goal. One additional aspect that I might tackle, which is the telemedicine or the telehealth and telepsychiatry. It might replace some of the workforce by intervening with artificial intelligence. Today there are a lot of tools in the market to cater such need or that demand for the workforce. I had a couple of discussions with AI entities whom are willing to implement these kind of diagnostic procedure at a very early days, where it will help in treating those patients earlier. So I think work in progress. The plan is operationalized, and we are in execution mode.
Yes, fantastic. That's music to my ears to hear. No, of course, I think what we need, obviously using technology to be able to outreach people, in remote area. I think, that's what we said, like when we have resources, we can get that. Stigma is always obviously our biggest thing, and sitting here talking about mental health, probably 10 years ago we will not be doing that. So I think that's give a lot, like a good message to everybody, so like all the people sitting here, if we're going to look about the rate of mental health, I can challenge there's almost no family without a member of them suffering from mental health issue at the moment. So there's nobody immune, and I think, being able to reach out to people and make like a lot of awareness is also the key.
If I can take it a little bit away from illness and go back to the fact that we need a workforce not only of psychiatrists, we need a very strong workforce that have psychologists, therapists, coaches, even the social worker aspects of it. We need to build that system so that by the time a psychiatrist is needed, he's really getting people that need real help, and they were not managed ahead of time or protected ahead of time. I'll still have to say that artificial intelligence is really great. It will help a lot in remote areas. We still find people prefer the human touch. So all the surveys that we did, people are still very highly emphasizing on the need for a human that they can trust. The problem is that they can trust. And I think this is where the issue is.
I think that was also added within, IFHAS. Some of the patients, they were preferred to see psychologists, to do that screening instead of filling piece of paper. So there is a demand, there is a need for such, workforce or manpower to be within the whole ecosystem. I don't know whether you would like to add.
Yes, absolutely. I think just being included on a panel as a clinical psychologist is, of course, a pleasant surprise. And I greet it. And I think, in today's world where nobody has time for anything and everybody wants a very quick solution, right? Everybody wants a chill pill or happy pill. And then to actually engage people in therapeutic process, it's a challenge, especially young people, because there's no patience, there's no time. But once we engage them in the process, I can confirm that, yes, they enjoy the attention, they enjoy the care that they get, they enjoy compassion and empathy that we come with. But to become a clinical psychologist, it takes years of training. And this is to Dr. Samer's point. To get the workforce, it takes years, it takes a lot of money, it takes a lot of training, and that cannot be accelerated, fast enough, I believe. So I think we have to also still, while we're developing that, keep investing in normalizing the care in a sense of access to the care through primary care, low-level interventions, because most of the disorders, mental health disorders, they are at mild and moderate level. They can be easily handled without including any of our specialists, and successfully. Any intervention is prevention, especially with young people. So that's why we encourage, it's very close to my heart, to make it accessible to everybody. It should not be this expensive thing that only rich people can afford. We offer at NYU free therapy for all of our students all around the world for as long as they are students. That's a lot of money that we are investing, and they appreciate it. But then we don't want them to stop with therapy once they're out of university and they will not be able to afford it.
I'm going to follow up on that point, Dr. Vedran. I'm going to ask you about some other joint ventures or some other initiatives that NYU applies to raise mental health awareness among its students, because university is just the final step before entering the workforce and before joining this a bit of a crazy world out there. So what ventures are you part of? What ventures do you apply to really prepare students for what's next?
We put a lot of value on mental health, not because we think that all students require mental health support, but for those who need it, we want to be able to provide it. We normalize this for most of our students because it's a very diverse socioeconomic background they all come from. It's the first time they have access to this kind of care. It goes back to the point that Dr. Khalid made about, health literacy, developing a sense of when do I need to reach out for help, but also educating them. And I want to point this out about their individual responsibility about their health and mental health. I think each and every one of us, it's a shared responsibility. Lifestyle makes a huge difference when it comes to mental health. Dr. Samer can confirm, you can have the best medication, but if the person doesn't have the right lifestyle, doesn't have the support of the family, it will not work. So we also, because it's a higher education institution, we teach, we learn, but we also try to learn from the community we are in. We try to contribute as much as we can. So we educate students through outreach programs that are accessible, that are adjusted to them, Instagram, Twitter, quick stuff, like 10-second videos, how to breathe. But still students will come back and say, I still have panic attacks. Why? I don't know how to breathe. Did you try out relaxation techniques? No, I didn't have time. You see, so it's also about understanding that we need to invest time if we want to be healthy as well. So it's a process, and it's a future workforce, as you said. These students we see them partially as our children because we're all parents, but also as our future. This is the future workforce, just like our teenage children. So help us God with that workforce. So we need to educate them to be more robust. My biggest worry with Generation Z and generation to come is lack of robustness, lack of resilience that we used to have growing up. And I know I'm going to sound old now, but really, I think building them up is so important, and we all need to invest in that.
Dr. Khalid, I'm going to come to you on to build up on what Dr. Vedrana was saying. For the youth of this region, aside from education, aside from the programs that were just discussed right now, what else would you say is needed to do? What would you say is lacking? What would you say is needed to really prepare our youth or to give them the sort of mental health awareness that they need?
Thank you. I think, as I mentioned earlier on, that, and I think the speakers were mentioning that the need is to make sure that mental health is everybody's business. It is not the business of mental health professionals alone. And if you look at the initiatives from WHO and other UN agencies, you would see that this whole concept of task sharing is being rolled out in an extensive manner, including in UAE. And we have tools like the Mental Health Gap Action Package. Similarly, there are tools for adolescents and children, particularly for psychosocial interventions, not just pharmacological interventions, which can be used by non-specialists. And by non-specialists, I mean not only healthcare professionals, but non-healthcare professionals as well, who can help. So that would mean that instead of what we are seeing at this point, that we have around 8 per 10,000 mental health professionals in this region, as opposed to more than 50 in European region. So it's unlikely that we'll be able to expand the specialist workforce that rapidly, but at least we can bring in non-specialists to help and make sure that they provide mental health care. Second, the issue which you were talking about, the adolescents and youth, I think the most important issue is engaging. We need to engage with them. We need to listen to them, that what are the problems, rather than providing them with solutions. It's important that we develop solutions with them, engage, understand what are their perspectives. And when you look at some of the surveys which were done during COVID, you could see the concerns of adolescents were very different from the concerns of older adults or younger children. So that, I think, is the key issue: engaging, listening to them, and making them part of the solution. Over to you.
Thank you, Dr. Khalid. Dr. Samir, my question is for you now. So we've just been talking about, again, the importance of mental health and how to prepare our youth to be mentally healthy and how to be mentally prepared. But then again, in order to have that, we also need a workforce in the health sector that is also mentally aware, also mentally healthy. So what is Al Reem Hospital doing to raise mental health awareness among its staff, and what should hospitals be doing in the region in general?
I think, over the years, I work with Reem Hospital and other hospital. To start with, the stigma about mental health is big, even within the health sector. So when I talk to colleagues, yes, at times they don't take us seriously in a way. They think mental health, yes, that's something, on the side, even within the health sector. Interesting enough, when I have colleagues, even themselves, unaware about their mental health issues, they're quite sick, or they have their family members, and they come to me and kind of, let's say, yes, kind of do it quickly, more or less. I think now with time, showing the importance, within the health sector about how is what we talked about, no health without mental health. When I sit and educate my colleagues who are endocrinologists, about their diabetes of the patient gets better when I treat the depression of the patient. Forget the depression, I need to treat the depression for your diabetic patient. When I show them figures about people after MI, they are 5 times more likely to die if I don't treat their depression. So forget the depression itself. I'm talking about the outcome of their patient and their health of their patient. So when we work about, when we show science, and I think that's the weakness that we had over the years, when we talk about mental illness, we don't use scientific data. alhamdulillah, there's more and more science to show that actually, I'm improving the health of the patients when I'm improving their mental health. Actually, when I talk to people who are, we're talking about economy, when I show them how much saving on health would be when I treat the mental health. So when we talk about even money with that, I think that's making more people taking that more seriously, rather than their goodwill. So we're working with the clinicians, with the health people, to show that, we're improving health. We're working with the hospital to show that we're improving productivity. So when I have a happy, well in their mental health, staff, I would have better, productivity, so they can do better jobs. So that would help everybody, the hospital, everybody. So when we show the evidence with that, because nowadays science is pure evidence. There's no more like, yes, I think that they're gonna feel better. No, actually, I can have now evidence to say that actually exercise help mental health, help cognition, and that is proven by science. Now I can go, rather than, okay, let's, go for a run for 3 days and then you'll be fine. No, I can tell them you have to run for 5 days, you have to do exercise 5 days a week, 40 minutes with high intensity, then I improve your depression by this. So when we go with this, and that's what we've been trying to do, and that's what we're trying to, or what I'm trying to show today, is when we have science to support our evidence, we're able to do much better with our hospitals and get the policymakers, or hospital managers to agree on supporting mental health, and that's, I think, that's the way forward with all of that.
If you allow me, it just brought me to the study that the Department of Health has conducted, the social economic impact study, where it shows that if the employer, it's not only the hospital, if the employer invests 1 dirham for mental well-being, for mental health, or for mental screening, that will save 4 dirhams. So imagine this simple equation: 1 dirham investment on mental well-being, it will save 4 dirhams in terms of productivity, in terms of presenteeism, where people are, not showing, or absenteeism because of depression, they are not feeling good, they are not feeling well. So it all impact on the productivity, it's all impact on the whole, let's say, organizational performance. So 1 dirham investment, it has that 4 dirhams of saving at over, the organizational level.
We're going to follow up on that, actually, on improving mental health in the workplace, but I'm just going to hear from Dr. Khalid before we lose him on Zoom. Dr. Khalid, and this is a shared question that we're going to hear from all of you, but what is one policy that you would advocate for to improve mental health in the workplace, so situations, people don't deteriorate, or we don't reach to this level where we have a lot of demand and not enough services?
I think if you look at our website, for example, we have recently launched a joint WHO ILO report and policy brief on workplace mental health. And the World Mental Health Report came out earlier last year. Both of them have very cogent recommendations about that. But the key thing is that we need to remember that individual level interventions are the last part. They should come at the end with people who might have problems. It's the policies of the organizations and the improving the knowledge and skills of the people who are in supervisory positions, which is key. And unfortunately, whenever we talk about workplace mental health, the first thing which comes up is that we have put in a clinic for mental health. No, that's the last thing which should happen. The first thing is that we need to look at the way the policies, particularly HR, administrative and financial policies, how they are organized, and look at it from a mental health lens. All the policies and laws and rules and regulations need to be looked at from a mental health lens. That are they promoting the mental health of people? For example, people who are nursing mothers, mothers with young children. What are we doing for them? Are we providing for daycare centers? Are we making sure that they have access to the children? Are we giving them some breathing space? People who have had mental health problems, are we trying to reintegrate them back into the workforce? And are we providing them with some support for that? Those are the kind of policies we need to look at first, rather than start thinking in terms of setting up a mental health clinic. That should be the last part. That's only a small proportion of people who would need to go to the clinic. If right policies are in place and the supervisors and managers are properly trained in how to promote the mental health of their workforce, and at the same time prevent mental health problems, including sexual and emotional exploitation and so on, which goes on all the time. So that, and as I said, that we have already articulated it in the form of a policy brief, which is available on our website. And we have also developed a mental health platform, which is anyone can access it, and it helps individuals to see their own mental health and to do exercises in terms of reducing stress, including for substance use and suicide prevention. Over to you.
Thank you, Dr. Khalid. I can see some of the ladies here nodding in agreement with you. I personally don't want this discussion to end. I don't know about you, but I'm just going to take some final questions from the audience and final comments from the speakers if you would like to add anything before we wrap up. No questions?
I think we have covered it.
Everything is clear.
I'm not sure who to direct this question to, but something that the public audience would want to know. As like mental health patients, how do we know where do we start? Who do we start with? Is it therapy? Is it a psychiatrist? Where does the journey start?
Maybe I can start answering the question. It's a great question. I think it can be a huge obstacle for people when they recognize that they have an issue, or maybe they're not sure that they have an issue. What do I do now? So it's really good just to reach out to wherever instead of not doing anything about it. And please don't do the Google doctor thing and self-diagnose. If I can just advocate for, if you can have policy on that, like no Google doctor, that would be great. But even if you Googled yourself and you think you know what you have, whatever is accessible to the person, it should be their first step. Normally, it's a general practitioner, primary care doctor, somebody you know and trust. We talked about trust. It's so important. Confidentiality is so important. If you trust your doctor, even if it's your gynecologist, even if it's your dermatologist, talk to this person, talk to this professional first. They will refer you further. All of our doctors who are not specialized in mental health, they know how to refer to us. Now, if you want to engage in therapy, you also need to know who to go to, because there are many people who call themselves therapists. They might not be, with the right credentials. They need to be licensed with DOH, like we all are, or for Department of Health of Dubai. So you also have to look for credentials of that person. And then you try it out. Research, what Dr. Samer was saying, in terms of therapy tells us that the only indicator of the success of the treatment when it comes to psychotherapy is the relationship between the patient and their clinician, their therapist. Not the background of the therapist, not the kind of therapy they apply, but the relationship. For that, you need time to develop, right? Now, if you don't feel good and comfortable with whoever is treating you, don't continue. That's my big advice. Please don't stay stuck and not make progress. There's plenty of other people. We all understand. Patients switch between us all the time. It's fine. So just own the process as well, right? It's really important to have agency as a patient to choose your clinician and to feel comfortable in the process and to feel that you trust your provider. That's my advice.
Thank you. If no one has any further questions, any further comments, I'd like to thank you all for attending this panel discussion. It was very informative for me personally, someone very passionate about mental health, and I'm sure it was also very informative for you. Thank you so much for attending. Thank you so much for joining us, sharing that beautiful knowledge with us. I think we can end it on a very promising note that we might not be where we want to be yet, but we are certainly on the way. So thank you so much. Round of applause for the speaker.
Thank you very much.
Thank you for having me.
And bye-bye.
Thank you, Dr. Khalid.
Thank you.
Bye. Bye. Bye.